my father, 1970s, 1974, actually, where he started with the eye center, and now we are 40 plus years in. So this is a few snapshots of our center. This is our operating sites where we have our outpatient and then seeing patients and different instruments. As you will see afterwards, there are a lot of instruments in eye care, and we use a lot of these toys to actually, well, I call them toys, but they're actually very useful to give information and how we treat and diagnose patients. So this is an example of our ward. We have a 4-story building, and this is the first floor where we have all our surgery done. And this actually, hopefully, is something unique where you have not seen before for those who have not seen the inside of an eye operating theater, and most places will have this. As you can see on the left side here is my colleague, and over on the right is me. We are operating by looking down this microscope. Underneath there is the patient, so we don't actually take the eye out of the patient and operate and put it back in. So this is how we operate when we do eye surgery. And this one I will elaborate later, but very important topic and important condition that we treat and see every day is cataract. And I'll talk about it a lot more later. But rest assured that at our center, we offer advanced technology, and these are different machines, how we deliver care for our cataract patients. We also do retinal service. Now, retina, I think Mr. Pang mentioned I'm a vitreoretinal surgeon, or what that means, basically, I'm a specialist in retina. Retina is not a part of the eye that everybody is familiar with. I think everybody's heard of cataract, but retina is like the nerve layer of the eye, and conditions such as diabetes can cause problems with it. Macular degeneration, retinal detachment, these things listed here are things that I manage on a day-to-day basis. And this is a machine, again, that we use to treat this in terms of surgery. So we also do LASIK here. So I think LASIK is commonly done, and most people are aware for the people who don't like glasses or are short-sighted, have astigmatism, or all sorts of other vision problems. We can correct that with LASIK, and I think that's done quite commonly everywhere. But we have a very good platform in Ipoh for many years now, and we're delivering good care with our LASIK machine as well. We also, as I mentioned, use a lot of advanced technology, and this is similar to an MRI scan that you can do of the eye, and specifically looking at problems in the retina. And this OCT, this very long term, just means that it's a machine that is used to scan the eye very quickly, take a good image with a lot of detail that can tell us about eye diseases and help us treat our patients. So we also have optometrists. Now, optometrists are specialists also in vision care, where they've gone through training in a degree course in university, and they come out specialized in checking power for the eyes, management of contact lenses, and diagnosing problems like cataract, glaucoma, and things like that. And then they can refer on to doctors to treat. They are not doctors, but they can actually do a lot of the diagnosing and management of the checking of diseases, and then refer on to the doctor. So we have 3 optometrists in our center who can do this. We also have our own optical shop. So if you do happen to visit us in Ipoh, if you require any eye services or eye care management, we can do that. And if you need glasses, we also have our optical shop to cater to your needs. So as mentioned, I'm the medical director of the center. I deal with all the medical problems, so to speak, or the medical side and management of diseases and things like that. Ophthalmologist, that's a very long term, which actually just means an eye doctor. And comprehensive means that I deal with a wide range of eye diseases, and most of us do, but I'm also subspecialized into the retina area. So straight into the topic now, I think a very brief introduction of where I'm from and what we do in Ipoh. But what I was thinking of talking about something relevant to our current situation is how COVID-19 will affect us and our vision, and how we can manage to continue looking after our eyes during this COVID-19 period. So I'm not going to go into detail about COVID-19. Everybody has seen a picture of this now. I think this was suddenly thrown into our faces in the last 4, 5 months, 6 months perhaps, when we were faced with this coronavirus disease 2019. That's what COVID-19 is. It is a novel or new virus that nobody has seen before. Nobody knows how to treat, and nobody knows whether there's any vaccine coming up soon. But it's known to be originating from animals. They call it zoonotic origin. I think a lot of theories as to where it came from. Of course, China has been mentioned because they reported the case first. And it's become now passing from human to human. So it's very contagious. I think you look at reports, and people have talked about the fact that those that have no symptoms or very mild symptoms where they recover quite well without having to go to hospital is about 80% of us. So about 40 to 50% no symptoms, but a total about 80% will not have significant symptoms. Now, there are 15% that actually fall quite sick, they need to go into hospital, and 5% get very sick. And you heard about people dying from this, probably about a small percentage of people can die from this, usually from complications related to breathing or your lungs. So again, these are advices that has been coming out throughout all the internet, all the social media. You hear people talking about this. We watch a lot of videos talking about this. And our DG in Malaysia has also already hammered home the information of what kind of symptoms that we get with COVID-19. The common ones is like fever, cough, shortness of breath. But when we read scientific or medical literature, more and more information comes out almost daily or weekly about new ways that COVID-19 can affect us. Children can present in different ways, and the elderly can have some, as reported, as even brain infections. But we know so little about this disease, so we're still learning more things. But we do know how we can minimize the spread, and people are talking about masks. I think since 1st of August in Malaysia, we have certain very strict guidelines on when to wear our masks. Not so much to just protect ourselves, but you must think about the fact that when we wear the mask, we're protecting other people as well. So we must not be selfish. Wearing a mask, it might be uncomfortable, but it helps to stop the spread of germs, because we don't know if we ourselves have this COVID-19 unless we get tested, because we may not have symptoms. And we happen to come across somebody who is more prone to getting it, we talk and we don't wear a mask, they can get infected. So cleaning your hands with disinfectants and wearing masks, social distancing, very important. That's why we are so socially distant now. Normally, for all these kind of public forums, I'll be standing in a room with a lot of people, 100 people maybe or more, asking questions, but now we're doing it online. So these are one of the new things that we have come to learn, to adapt to. So the other thing this is just a chart to highlight, I think this is available online, just to highlight actually when the pandemic started. So on the y-axis is the number of confirmed deaths due to COVID, and on the x-axis is actually the confirmed cases. So if you look at where Malaysia sits, which is not too bad, we're somewhere in the middle. We're not actually way up there in the number of deaths or number of confirmed cases. And this is up to date to 31st of July. So we're sitting somewhere in the middle, not too bad, but Mr. Pang just mentioned to me as we were chatting before we all came on live, is Malaysians have very short-term memory. So don't forget, and don't just be so lax now and go out. Don't forget to bring your mask along, wear your mask, because it's not over yet. We are still in the middle of a pandemic, and DG keeps reminding us, so I'm here to remind you the same as well. Just a few little slides just to emphasize that point. If you look at why it's important, it's because, yes, it's a very low rate of infection and die from it. It's not common, but if it happens to somebody that you know, it happens. And we don't know who it's going to affect, and we don't have no treatment or vaccine. So this chart actually looks at by age. If you look at the bottom part, those 80 plus years old, you see a very long green line here in a country like Italy. Up to 20% of people over the age of 80 are likely to die from it in COVID-19. And these are case fatality, means you die from COVID-19. Very young, very rare. So if you're a young child, not likely to actually get sick or die from it. But if you're older, the older you get, going beyond 60, 70, 80 years old, your risk gets higher and higher. The other thing, of course, in Malaysia, I think it's not uncommon that we have either high blood pressure, diabetes, or cholesterol, or all three. I think in Chinese, we call it Samgo, and in the three high things, the high cholesterol, high sugar, and high blood pressure. And if you have any of these, you're more likely to actually succumb or die from this disease as well. And this is a report from China. If you have heart problems, you're 10% more likely to actually die from COVID-19. So this group of people also have to be very careful. And when we go out, we must be mindful that why we want to protect these people by wearing masks, because you might be perfectly fine, but you might come across people who you don't know, strangers who may have this. So you must think about that. Now, besides impacts directly on our health, so what has it happened? Now, we had to come across so many measures to actually stop the spread of this very infectious disease. So in Malaysia, not uncommon to the rest of the world, the MCO started in March 18th. And what happens until now, we're still in a form of MCO, but slowly opening up. But really, I think the last few months, especially March, April, May, you see that businesses were closed, schools were closed, and there was no tourism. I think in KL, of course, impact is great. I think you got a bigger population, but even in Ipoh, we have a lot of tourism where people come and they love the food here, and then, you know, tourism can be a big part of the economy. So this is an example of how all the planes, perhaps worldwide, many airports where the planes are just parked there, nobody's flying anywhere. So it has a big socio-economic impact. And it's caused lifestyle changes to us. We can't go out where we want. And this is a place in Ipoh, actually, where we actually go. We are getting so used to people pointing little guns at our head and pressing a trigger. So you say, please shoot me with this infrared thermometer to check my temperature. And that is something that we've gotten used to. In fact, it is a protocol that we have to follow. If you don't, you're going to get penalized for the businesses. So we have to make sure we do this. Hand sanitizers we carry around, or they're provided at all the businesses that we go to make sure that our hands are clean. And this is another thing. This is actually an image of my staff. You know, I'm not a big group here. We have 20, 30 staff at LEC. And what happens is this is how we are actually conducting meetings now from the comforts of our home. Right now, I'm actually at home. I know I have a background there, but I'm at home now. So we are conducting forums, meetings, management meetings, business meetings online. And this is something that before 6 months ago, maybe it was available, the technology, but we never used it as much. So Facebook Live and Zoom's shares has gone way high now because of this pandemic. So one of the few businesses that has profited from this pandemic is Zoom, because everybody is using it. Okay, now more pertinent now to our eyes, I'm going to talk a little bit about COVID and our eyes. I think if you read enough online or social media, or you read some newspaper articles or scientific articles, you will know that COVID can affect our eyes, and it can cause what we call conjunctivitis or pink eye. It's basically an infection, because COVID-19 is actually a viral infection. So when you get an infection in the eye, you can get redness, irritation, itchiness, tearing, discharge. These are all typical signs and symptoms of an infection in your eye. So COVID is one of the viruses that can do it, but more commonly, other viruses or bacteria can do it. I think we see people with conjunctivitis on a daily basis in our clinic. Now, how many of them have COVID? Very rare. As the reports have shown from this paper in China, who first reported when they looked at 38 patients, only 12 of them showed some signs of conjunctivitis. And usually, I highlighted here, usually in patients with severe disease. So fortunately, it doesn't affect the eyes in a big way, but it can affect the eyes. But what's more important is not so much how it affects the eyes, but how it can be transmitted through the eyes. Now, as you know, many of us can be no symptoms or very mild symptoms. But having said that, how can we transmit it? Through our eyes? Because let's say what happens, you don't wear a mask, you go into a public situation, somebody coughs or is talking to you, too close to you, spray of saliva comes out, and it doesn't have to be big droplets that you feel wet on your face, because when you talk, you get small little spray that you may not actually feel or see, but those particles can drop onto your eyes and get into your eyes and cause an infection. The other thing, of course, if you also already have an infection and you have tearing or your tears come out, people who contact your tears can also get infected that way. So transmission through our eyes is one possibility, and is something that has been reported. So again, comes down to wearing your mask to stop those droplets from flying from your mouth, and to protect your face as well, partly from droplets coming in. And important is, of course, whatever you touch with your hands, don't touch your face or your eyes. So some of the changes at LEC we have implemented, just as much as I mentioned how we have been impacted in many ways. So in order to make sure that we are able to continue to serve our patients' eye care problems and needs, we have been able to enforce certain changes to actually make sure we are safe for patients to come and to actually treat them. So this is a short video. I think you may not actually have any audio in the Facebook. I think Mr. Pang mentioned that, but I'll talk you through it. So this is just a quick 1-2 minute video to show some of the things we are doing. So those of us know Ipoh, we are actually located here. And what is important during this period of the COVID-19 is the fact that we have continued to be business as usual as much as possible. So we do screening. Of course, we take history and ask our patients where they come from, and whether they actually have any temperature and any contact with people who have had recent temperature or confirmed COVID or suspected COVID. And we have to do contact tracing, so we register patients. Now there's the MySejahtera app, or there's a QR code that we can actually capture patients' information as well. Social distancing is one thing. I think we hear enough about that. So we can't have patients sit very close together. So we have put little markers to make sure that patients don't sit where they're not supposed to make sure that they are big enough groups. We have also allowed a lot of cleaning to be done. So make sure disinfection of the door handles, the chairs, the countertops, and even our instruments, as I'll show later. And the other thing also, we want to make sure there's good circulation and there's a lot of air purifiers around, allow air to go through the center rather than have an aircon always recirculating the same air. So all those things are things that we have implemented. One thing we've also tried to make changes to our processes. So afterwards I'll highlight a little bit more, but we cannot have patients to suddenly come all at the same time because we are a multi-group practice. We have 4 doctors with us. So if we have 4 doctors there and we end up with patients for all 4 doctors, it can get very crowded and there's no social distancing. So we are trying to change our protocols. So any inconvenience caused is of course much regretted, but we have to try and stay safe. So somehow we're making sure that patients come in a staggered manner. So those are some of the ways that we have actually tried to make sure that we are safe in the environment for our patients as they come in to see us. So making an appointment is important. Why? Because when you want to come and see us, I think it's better if you have an appointment so that we can plan for it rather than a lot of people just coming in and trying to see on the first come, first serve, because we're not able to plan for it easier. So there are different ways you can call us. You can actually go to our website, email us, you can go to our Facebook page, you can go to our Instagram, you can go to this app here called the AnchorMed, which is actually an online appointment system. So for example, here, this is just when you click or download the app, which is available on App Store or Google Play. You can go in, search for us, LEC Eye Center, and then you can actually make appointments to see, for example, me. You can choose the date and you look at the time slot that you want to come at, and you can get an SMS confirmation of your appointment. What we've also been doing since the MCO, we're actually delivering medication to our patients because we have patients that have problems coming in because of MCO and they're not able to use their regular medication, especially those who have glaucoma. They need to use lifelong eye drops to maintain their condition and to treat themselves. So we deliver medication, which we're still doing. And we also have online consultation. So not so much that we can actually do very extensive testing when we're seeing somebody online like now, but at least if you have questions about your eye, we're able to answer your questions or answer some of your concerns. If you have anything that we can actually have a quick look if it's external, and we can decide whether you need to come in urgently or perhaps send you out some eye drops to actually try to medicate if it was just a mild infection or allergy or something, then you can save you that visit and the convenience of not having to come into our center. So these are the things that we have changed during our time to have learned to actually adapt to the COVID-19 to make sure that during this pandemic and moving forward, we are still able to look after our patients. So I'm going to move into the main gist of the topic now because PS mentioned earlier about this important topic about cataract, and there are a lot of questions coming in about, cataract surgery and what it involves. So now I'm going to talk about that. So I mentioned earlier, this slide you have seen that some of the things that we do at LEC, the most important of which and most common condition is cataract. And really cataract is the lens inside the eye. I'll show a little video to explain that. That's basically gone cloudy because of age. So these machines here, going from the left to the right, are machines that we use to accurately, number one in the left side, to predict the power of the lens that has to go into the eye when we actually do cataract surgery. And the one in the middle here is like a digital guide that we take an image of the eye. So during surgery, as you see just now, we don't take the eye out. We operate with a microscope looking at the eye to actually accurately make all our treatments, our incision, our surgery using a digital guide. So computerized now to some extent. And the final thing on the right side here is an advanced machine that uses high frequency ultrasound to actually break up your lens or your cataract and suck it out. Then after that, we can put a lens in. So I like to always talk about myths about any condition, and cataract in this case. Why do I call it myths? Because we are in a multiracial society, and each race has their own so-called old wives' tales or traditional treatment or traditional medicine as to how to manage certain conditions and what they actually are. So cataract has a lot of myths about them. And one of the most common I found since I returned here to practice is they think that cataract is something that grows in the eye or on top of the eye, on the surface of the eye. And they say, oh, they'll always ask, is my mock, or in Cantonese, they call it mock, is it cataract inside or outside? Is something growing inside or outside? So really, if you look at how the eye is, this is a cross-section. If you cut the eyeball in half, you look at it from the side, this is how the actual eye looks like. So the front of the eye is on this side, the back of the eye is here. So what is in the middle, this thing that I'm pointing at here now, is the actual cataract or the lens. So as we age, it is this lens that becomes cloudy. So the lens is like our hair or like our fingernails, it continues to grow. Throughout life, it doesn't stop. It gets more and more thick and more dirty because it's like a window that doesn't get clean. So at some point, usually beyond the age of 60 plus, maybe 70, then you will get a cataract, which is bad enough that you will need surgery so that you can actually see better again. So this is another short video. I'll again talk you through it for those on Facebook that don't have the audio. It's actually to explain what a cataract is. Okay, it is a video by that you can actually see online, but I've used it several times to explain things well. So as I mentioned, it's very common. Everybody gets it. If you live long enough, you're going to need to actually have cataract surgery. So what happens is people present with cataract problems, either causing blurring, or it can be glaring, or it's affecting their actual lifestyle and things that they want to do. So as shown here, so I already mentioned that the lens itself normally is very clear in a normal eye. And all the light rays that come through supposed to get focused on the retina, or it's like the nerve layer of the eye. So if you get a cataract, everything becomes blur. So it's not sharply focused anymore. And what happens then, this is just a small little animated video to show you how cataract surgery is done. I will show you a live video of mine afterwards to show how it's done. But essentially, we make a little cut on the surface of the eye, very small one, usually between 2 to 3 millimeters. We go in with the instrument, suck out the lens, and then after that, we put in an implant. And this implant has changed over the years when cataract surgery first started to be this way. And there are many different options available, and I'll talk about that later as to the type of lens that you can use to correct your vision. So this video here now shows, excuse me, how when you don't have a cataract anymore, everything is very sharply focused and your vision has improved. So cataract is one of those conditions that it can really cure. So if you get a very bad cataract and no other eye problems, we take the cataract out, we can restore your vision to what it was before. And it actually is a very successful operation that, as an eye doctor, I'm very proud to be able to do it for my patients. So symptoms of cataract, for example, this picture just shows on the side, looking at this building, normal, looks sharp. When you got some cataract, it looks hazy. Some people have described it as smoky vision. And then if it gets worse, it becomes more and more blur. So this is like an advanced cataract. Actually, you can get even worse. You can go completely dark and you only see shapes and shadows because, in fact, yesterday I just saw a patient that just sat on the cataract until it's like almost so dense that you can just about see light and nothing else. So that's not what we want because there's no quality of life if your vision is so bad. So as mentioned already, everybody gets cataract. Why? Because we get older. So unless I have patients that ask me, is there eye drops I can do, or is there something I can take to stop the cataract from coming? I say no, unless you discover how to not get older. Otherwise, everybody is going to get cataract. So age is the most common risk factor for developing cataract. There are some people who get it because of genes. So in some families, you can get a gene that causes cataract earlier, and it can be passed down to their offspring, their family. So the hereditary is possible. Other medical problems is one thing that can cause cataract. Example is diabetes. Diabetes can actually cause cataract to come earlier. And there are other conditions that can actually do that as well. Now, if you have an injury to the eye, let's say you sometimes, unfortunately, I have seen, of course, people that work with sharp tools or, the grinding or welding. Sometimes they don't wear their goggles. So you get flying bits flying into the eye. And if it's a bad injury, the metal object flies very quickly and into the eye and penetrates the eye. You can develop problems. Cataract is one of them that can come from that, but they can also cause other problems as well. Now, injury to the eye can be something as simple as, commonly I see is shuttlecock injuries. People love badminton in Malaysia. So shuttlecock actually fits very nicely into the eye socket, unfortunately, because the size of it, when it comes, it actually can hit the eyeball very, very powerfully when it gets hit there. And I've seen a lot of injuries from there. So you can get an injury from a shuttlecock, which doesn't mean you get a cataract straight away, but you could get a cataract 5 or 10 years down the line. So this kind of thing can happen from injury as well. Medications, more specifically, if you are on medications called steroids, steroids can be used in many ways for people who have asthma, for people who have very bad skin problems, for treating inflammation, people take tablets. So these steroids can actually cause cataract as well. And sometimes in people who work outdoors a lot, or they go outdoors a lot and they don't protect their eyes so much, sometimes you got long unprotected exposure to the sun, you can get cataracts earlier. So what is the treatment? I think we talked about surgery. So surgery is obviously the main way of treating cataracts. But as I said, as we get older, the cataract doesn't suddenly just come. It usually comes slowly. And usually beyond the age of 50, 55, you will start developing a little bit of cataract. And how that affects you is you might notice, how come my glasses are not so good? Or how come my vision is a little bit off? I need brighter lighting to see. And sometimes you go to the optician, then you make glasses, then you go, oh, okay, it's better. So glasses can treat early cataracts. And not everybody that gets cataracts needs surgery straight away. If they're quite happy to try and manage with glasses, I think a lot of my patients, I tell them, you can delay surgery for a little while. But prepare that at some point in the future, you do need it. But surgery is definitely the mainstay of treatment. So the second myth that I'm going to talk about is when to do cataract surgery. So a lot of the older ladies and gentlemen that I see with cataracts will then say, oh, I must wait until it becomes ripe, isn't it? That's what I've been told. You know, ripe means that it's ready to be done. When can it be ripe? Like when can it be plucked out from a tree? So actually that concept is more or less now not really used, or rather I don't use it to explain it to my patients. I tend to tell them when it interferes with your daily activities. So of course, if you come with a very dense cataract like the patient I saw yesterday, there's no argument. You have to do it because you're blind, literally, you can't see. But most of the time, people have a bit of blurring, and they then question, okay, I have cataract, so doctor, when should I do it? You tell me. So I would then question and ask, when is it interfering with your activities? So if you're still active, a lot of baby boomers in their 60s, 70s now are still very active. They drive, they read, they do a lot of computer, they come online a lot of the time. So are you still able to do those activities and enjoy them? If you are, then you can delay a little while, doesn't matter, but we have to follow up to see how things are. So if, however, you find that I'm not driving safely, I'm not reading or watching comfortably, I can only read for 10 minutes, I feel very tired because it's straining, then it might be time to do something because you want good quality of life. You don't want to be struggling along trying to do the things that you love and just trying to avoid an operation because you think that it's going to be a big thing. So operations should be done only when necessary, but shouldn't be delayed if it can be actually carried out safely. So cataract surgery actually is done day surgery. So hardly, in fact, I've not admitted a patient overnight for cataract surgery for I don't know how many years already, because it doesn't need to be. So you come in, as I said, we are accredited Ministry of Health Day Surgery Center. So day surgery means you come in, we prepare for surgery, we do the surgery, and then make sure you're okay, and then you go home. So usually most patients will spend around 3 hours, 4 hours in our center, maybe about 3 hours, to make sure they're okay from the beginning to end, including the surgical time. And we do it under what we call topical anesthesia. So you're awake, no doubt, but we put eye drops to numb your eye. We sometimes have to give an injection around the eye, not into the eye, to numb the eye, depending on the type of cataract or the comfort level for the patient. But more important, we also give a little bit of medications to ensure that you are a little bit sedated, so not so anxious and not so worried about the whole procedure. And on average, the cataract operation will take 15, 20 minutes, and that's done. So this is how, I think you saw this image already. So this is an example of an operation being carried out. So I have an assistant with all the instruments, and then there's a patient under there. Believe me, there is someone under there. And then we have an individual to monitor the patient here, usually either anesthetic nurse or a doctor himself to monitor and give medication to the patient to make them calm. So this is me operating. You just zoom up, you see basically I'm having an instrument into the eye there. So this is how we operate. We actually don't see our hands. We look through the microscope and only see the eye. I'm going to show you a video afterwards. So I said, the next thing is about how it's actually done. So a lot of people have the impression it's done with laser, because laser is, for good or not so good reasons, that is very closely associated with eye conditions, because it was one of the first organs in the body that we use laser to actually treat conditions. So laser actually is used in many ways for treating the eye. And actually the least common thing that's being done to treat now in the eye is cataract. So actually cataract surgery is not done with a laser commonly. I will show that it is available, but not commonly done. So the most common method that's been used to treat cataract is high frequency ultrasound for the past 20, 25 years. This is how we do it. And that's what I will be talking about. This is a video I'm going to talk you through as well. So another video, and the last one I promise you, that will show you, for those of you who are hopefully not too squeamish, this is actually somebody's eye. Okay, you don't see the rest of the face, but this is the eye, and under the microscope, this is what we see as eye surgeons. So you will see two instruments. One coming inside this wound here is about 2.2 millimeters in my case, and this is about 1 millimeter wound where I hold the eye and stabilize the eye. And what we are doing here is making a small little opening in the capsule or the front layer of the cataract. So the cataract actually is a lens that sits inside a little bag. So we open the top part of the bag, and then I go in with this instrument. So in my right hand here, the main instrument is from that machine I showed you just now, that Centurion machine, where we actually use ultrasound to break up the lens. So with my left hand, you can see I'm actually making movements to break it into little pieces. And then you're wondering, how is it that everything seems to be disappearing into the tip of this? Because in my right foot, I'm controlling the actual machine like a vacuum cleaner. So I have a pedal that I'm stepping, letting go, stepping, letting go, stepping, to suck up the pieces of the cataract. So actually, for the cataract surgeon, in fact, for all eye surgeons, we are using our left hand, our right hand, our left foot, because our left foot is controlling the microscope. We can move the microscope around to actually focus on parts of the eye that we want to operate on. And the right foot controls the machine. And of course, we also use everything that's inside the head as well. So we're actually using quite a few different things at the same time to operate. So as you see, after we remove the main bulk of the lens, we also have those little sticky materials. And this part is the important part to actually correct your vision. This is actually the lens. So the lens looks like that. It's got a round part which actually has the power in it. And we actually fold it up into a little, well, Americans call it a taco. Over here, might call it a popia or something like a spring roll. We fold it up, it goes through the small incision, and then it slowly unfolds. So it is made of plastic, and it's a very quiet, inert plastic, we call it, that does not cause inflammation or any problems in the eye, and we leave it in the eye forever. So this technology has, the first lens implant was done over 50 years ago, or even longer. And now technology has improved such that we have better and better implants to go in. So that is how cataract surgery is done in the majority of the cases. Now, even in Malaysia or worldwide, there is something called laser or femtosecond laser, or people will market it as bladeless cataract surgery. So this one over here is an advert that I found online, basically. This one is in India, Chennai is in India. And people have always, nowadays, been putting up this kind of technology so that public is aware that it is available. And this is, yes, no doubt, an advancement in technology, but you must realize that for all scientific advancements, we have to actually use them only if they are doing good for our patients and they are actually practical to be used for our patients. So at the moment, the majority of the world still not doing this. I think over 95% of people are still doing cataract surgery, as I just shown you with the ultrasound. But there are also in Malaysia people who use this technology. Now, what is the difference? The difference is they will use a laser to actually open up the eye. So instead of using a blade, they call it, so it's bladeless, to open up the eye to put your instruments inside, they will also use a laser to break up the lens and create the opening into the cataract itself. So over here, the smaller image on the left side I'm circling here is the one where they will use the laser. But you don't forget, they will also, you need to use this machine that I showed earlier, which is the ultrasound machine, to suck it up. So you still need two machines to do it, which is more than what you do in the conventional. We only need one machine. Now, as a consequence of having to have two machines, so you see a lot of dollar signs here, it's a lot more expensive actually to carry out, because we have to invest in a lot more technology heavy instruments and cost heavy instruments. And what happens? Of course, the patient has to end up paying more. Now, paying more is not an issue if it has a lot of benefit. But what we find that at the moment, it is not shown to be safer or much better than the older method, so to speak. So we are still continuing with this so-called older method, but a very successful method, and we are continuing to use it more often than not. Even this is interesting because this is in Malaysia on the Star paper. On the 4th of March, 2 years ago, there was one of my colleagues, who actually uses this technology and is very good with it, and it believes that it is safer in his hands. Now, 2 days later, we straight away had another of my colleague, a representative of our Ophthalmology Society in Malaysia, who then says that actually there is no proof that shows that it is safer or better than the older way in the big study that was done worldwide. So at the moment, there's still a lot of differences in opinion as to what is the best way. But what is important is they both can be used, but what is the safest way that can be done in your eye doctor's hands? And at this moment, by and large, most of us are still using the ultrasound to actually do it. So moving on to another myth. So I was just talking about, as you showed, seen just now in the video, where there's an implant that goes into the eye. So that implant has to go in because, as I showed you earlier, this actually cataract is the lens that goes cloudy with age. So if we don't put in an implant after we take out the lens, then you can't see. So we have to put in an implant. You can't actually not do that. Otherwise, we will not correct your vision. This is a picture, and you'll see briefly just now in the video, you saw briefly is something like that. It looks a bit yellow. There's a center part, and then there's two legs. So those two legs actually go in. As you see, they folded and they open up. Now, because it sits inside this bag, so when it opens up, you actually make sure that the lens is stable inside. It doesn't move around so much. It just sits there and very stable. And there are different types of lens available. Most of them look like that. There are some which are different designs, and some different doctors will use different designs based on what they prefer or what results they get with it. And that's fine because they're all good implants. So for the layman or for the public, I'd like you to understand that essentially there are different functions for the implants. I mean, just like you go and buy a phone or buy a TV, there are so different, many different things. You got HD, you got this 4K and things like that. So they are all able to give you good quality TV image, but there are subtle differences to get more clarity. So similarly, when we actually talk about implants, they have different functions. So if you want to be able to see well, just for distance perhaps, but you don't mind wearing glasses, a monofocal implant can do that. But you still need glasses either for reading or maybe for computer work. So a lot of people will choose that because they're happy to actually just be able to see. Now, if you want to do a bit more, perhaps you want more independence from glasses, you don't want to depend on glasses so much, which a lot of my patients do. Then if they have astigmatism, then they do something what they call a toric implant, where they correct their vision. At the same time, they correct the astigmatism, and then they only need glasses for reading. Then after that, you have patients who then now feel like, I don't want to wear glasses, I'm fed up. I just want to be able to drive, I'm going to see my computer and read my messages or read my documents without any glasses. Then they go for a multifocal implant. And then subsequently, if you have all the different vision problems, like all the nearsightedness, farsightedness, astigmatism, and you call old flower or presbyopia or reading problem, then you can have this multifocal toric, which is obviously the most advanced technology one, which allows you more independence from your glasses. And when I say independence, means that probably 95, 98% of the time you don't need glasses. Now, when you read very small prints like medicine label bottles, you may still need to actually wear glasses for those. So how do you choose? Now, it's very important that actually you as the patient have to actually be able to understand what's available to you. And how do you understand? You ask questions from your doctor. So gone are the days where, patients will come and say to me, okay, just do what you want, doctor. Everything will be fine. It doesn't work that way. And I'm not comfortable doing that anyway, because I have to understand what the patient wants. And the worst thing is we are not giving the patient what they want and thinking that we've done our best and then they're not happy. So we need to understand. So the role of the eye doctor is to actually help you decide what is the best implant for you. So we need to understand whether you still work, what are your hobbies, do you like to read more or play mahjong or cook or things like that. So we understand that, then we can say, okay, if you want to be able to do these things without glasses, then you need this. Or you don't mind wearing glasses to read, then maybe this. So that's how we help. But we cannot decide for you because we don't live your life. We don't know what you do more or what you prefer, but we can give you the explanation and the options to help you choose. So we cannot choose for you. That's the most important thing. Now, don't forget, I'm talking about surgery. So when we talk about any surgery, I will always not forget to mention side effects. Now, side effects of cataract surgery is very rare, but the most common thing is dry eyes. So after surgery, because we disturb the surface of the eye, you can get dryness and you can get a little bit of discomfort, but you need eye drops to actually manage that. So there are some patients where if they don't understand, they say that after cataract surgery, I can see, but my eyes, I keep needing to use drops for longer term because the eyes are dry. Now, you can also get sometimes the cornea, the front layer or the front surface on the outside part of the eye can actually degenerate after cataract surgery. Not common, but it can happen. More serious, you can get retinal detachment or infections of the eye, which is things that we are very afraid of. So we always tell our patients, you need to use your eye drops, their antibiotics, and prevent inflammation and infection. Make sure you avoid dirty environments or rubbing your eye. at least during the first 1-2 weeks of after the surgery. Make sure you look after yourself well so that you don't get these problems. So all in all, if you talk about the risk of any blinding conditions from actual cataract surgery, is probably less than 1%. But most of the time, they are very safe, successful surgery. Final words now. I know I've been talking for a little while. So I just want to say that cataract, yes, it is a blinding condition. If you leave it alone and you don't treat it, you go blind. But it can be treated very successfully and with surgery. And of course, glasses in the initial part, if you're not keen, but later on you still need surgery. And the surgery is straightforward most of the time. 99 out of 100 is very safe, no pain, and within 15-20 minutes, we can get the surgery done. So you need to have a good conversation and understand from your eye surgeon what options you have before you decide what is the best for yourself and commit to surgery. So you don't ever have to really make a decision on the same day that you see your eye doctor. You can always get all the information, discuss with your families, ask your friends, and then decide. So now finally, talking about COVID-19 again, just very briefly to mention that we are all in a new situation. So I just want to hit home again the point that, don't relax yourself so quickly for all those who are listening on Facebook or for those on Zoom as well, because we are still not over the COVID-19. So remember, you still have to take care of yourself. So we have to have a future living with COVID until we know there's a good treatment or vaccine, which is not going to be available for a long time yet. So protect yourself. Don't touch your eyes and your face so much. If you're a contact lens wearer, contact lens wearers tend to get irritation, dry eyes. So you may need to touch your eye a bit more, dry your eyes with tissue. So make sure your hands are clean. And wearing glasses, some people say, oh, maybe there's an extra something to block any spray that come into your eye. So yeah, maybe wearing glasses, but of course it's not proven. So it might be an extra layer of protection. But wearing glasses, people also will make sure that they touch their glasses and readjust a lot of time. So remember to avoid that. And always wash and disinfect your hands, your glasses, and don't forget your phone, because your phone is something that we touch a lot and we use a lot. Everybody has a phone with them and we touch that a lot. We need to disinfect that when we get home so that we don't actually pass bugs around. Avoid rubbing your eyes, nose, and mouth, and don't touch your eyes and face, and make sure your hands are clean. So I thank you again for the opportunity, PS and MediSavers, for me to share with you over the past 45 minutes or so. And I look forward to any more interactions and questions from the audience. And thank you again once more. So to reach out to us, as I said, you can go to our website, check our Facebook. We have a YouTube, Instagram, call us and leave us a message or a comment, and then we'll get back to you. Thank you very much again, PS and MediSavers, and thank you all for listening.